Thanks for tuning in to the HRchat podcast. Hey, this is Bill Banham, one of the hosts of the show. Just before we get into today's episode, here's a quick message from one of our supporting partners.
We get people. We know what they want from work, why they join, why they leave, why they stay. We get tech, and we understand that it's never the whole solution. At Talent Solutions RPO, we work across every industry and talent market in the world. In the end, it's people who make the difference. Let Talent Solutions RPO help you get the people your organization needs. Visit mpgtalentsolutions.com/HRchat to learn more.
Welcome to the HRchat podcast, bringing the best of the HR and talent communities to you.
Over 650 million adults worldwide are obese, a condition not only associated with various chronic and expensive diseases like heart disease, diabetes, and some cancers, but also COVID-19 complications and mortality. In this HRchat episode, we're going to consider nutrition in relation to health equity and weight management for chronic conditions. Listen to this episode to learn how some chronic diseases can be prevented through healthy lifestyle behaviors, ways that digital therapeutics can be used to successfully manage obesity, nutrition platforms that will help increase health equity, access to nutritious food for all employees, and the social determinants that impact food choices and habits. In 2019, I had the opportunity to cover my first Thrive Summit and totally bought into the awesome things that Virgin Pulse are doing to help employees across the globe. My guests this time all partner in different ways with our show sponsor, Virgin Pulse, the wellbeing solution helping workers create habits that matter so they can be their best at work and at home. And they are Dr. David L. Katz, CEO at Diet ID and founder of True Health Initiative, Dr. Dexter Shurney, Chief Medical Officer and Senior Vice President of Clinical Affairs at Zipongo, and Mesa, former co-founder and Chief Health Officer at Mesa Health and current Product Marketing Manager at Virgin Pulse. Okay, so beyond my short introduction there, I'd love it if each of you now could take 30 seconds or so to introduce yourselves to our audience. David, why don't you go first?
Thanks very much, Bill. It's great to be with you, great to be with my colleagues. I'm a specialist in lifestyle medicine, preventive medicine, and public health. My career-long mission has been to do everything possible to prevent chronic disease, promote health, add years to lives, add life to years. And I'm delighted to join with you in a discussion that addresses those important issues.
Beautiful. Dexter, what about yourself?
Thank you, Bill, for having me here. It's great to be a part of this dialogue. I'm also a physician. I'm double boarded in both lifestyle medicine and preventive medicine. I'm the Chief Operating Officer for Food Smart by Zipongo. And I'm also the current president for the American College of Lifestyle Medicine. So I look forward to our dialogue today.
Wonderful. And just finally, I understand that she goes by Her Royal Highness. Mesa, why don't you tell our listeners a little bit about yourself?
Sure. Hi, everyone. Thanks, Bill. My name is Mesa Nuccio, and my background is in public health. So cancer prevention and early detection, as well as diabetes prevention and other lifestyle-related chronic conditions. I founded Mesa Health in 2015, co-founded rather, which is a digital therapeutic company that specializes in reducing members' risks of developing certain chronic conditions, and it was acquired by Virgin Pulse this year in 2020. So now I'm working at Virgin Pulse on the product marketing side and get to learn a lot about and talk a lot about how our products work and sort of what type of difference we're making in people's lives and in business outcomes.
Awesome. Now, listeners, as you probably gathered by now, this is a bit of a different format to our usual one-on-one style interview. I've got all of these wonderful luminaries on one call. And the way we're going to do it is I'm going to ask questions of each of our guests. I've got 3 or 4 questions for each of them before we loop back in with all 3 with some final thoughts. David, let's start with you. My first question for you today is it's around obesity rates. Frankly, they're at an all-time high. According to the WHO, 650 million adults worldwide are obese, a condition which is associated with various chronic and expensive diseases like heart disease and diabetes and some cancers. We're essentially battling 2 pandemics right now, okay? So we've got COVID-19 and chronic disease. In your opinion, what are the main causes of obesity? And in addition, how do our genetics versus our lifestyle behaviors influence chronic disease and obesity?
All good questions, Bill. And so first, I would make the case that obesity is a canary in the coal mine of chronic disease. There's lots of debate in our society about the relative importance of obesity because obviously it overlaps not just with our health, but self-esteem, appearance. So there are opportunities here for bias and societal prejudice to enter in the mix, and that's very unfortunate. We can focus really just on the direct health effects of obesity, and where there's more obesity, there is more diabetes, there is more coronary disease, there is more dementia, there is more stroke, there is more degenerative arthritis, and on it goes. So first and foremost, from a public health physician's point of view, from a clinician's point of view, obesity really is important to health. Second, you're absolutely right to highlight the confluence of 2 pandemics, and frankly, there's opportunity there. In the United States, for example, when COVID is severe in people under 50, it's almost inevitably because of obesity and chronic disease. And that's true around the world as well. And that means that if we modified our cardiometabolic risk, we would acutely modify our risk for severe COVID outcomes. So again, we're not helpless, even with regard to the viral pandemic. By addressing our longstanding health, we can defend ourselves acutely against the virus while improving our health for the long term. In terms of the root causes of obesity, Bill, I like to cite the work of Michael Moss. Michael is a Pulitzer Prize-winning investigative journalist, 2 books, Salt, Sugar, Fat, and Hooked. But I particularly like an excerpt from Salt, Sugar, Fat, a New York Times Magazine cover story, The Extraordinary Science of Addictive Junk Food, because that explains why we have epidemic obesity. Frankly, most people get fat when it's easier to get fat than to stay thin because animals are adapted to eat when there's good food available, and we're no different. Animals are adapted to avoid vigorous exercise when they don't have to do it, and we've got all kinds of labor-saving technology. But what puts this all on steroids is the story that Michael Moss and others have told. All the big global food corporations have scientists whose job it is to engineer food that is, for all intents and purposes, addictive to maximize the calories it takes to feel full. And frankly, this adulteration of the food supply is the major problem. And then finally, and there's much more to say on the topic, but I want to be as concise as possible on the issue of genes versus environmental influence. Our genes are much the same as they ever were. There's no question that we are genetically susceptible to weight gain and obesity because laying in a storage depot of energy against the advent of a rainy day favors survival in a world where calories are relatively scarce and hard to get and physical activity is unavoidable. But those are the same genes we've always had, and we have not always had pandemic obesity. What took the native vulnerability of our genes and transformed it into a global obesity pandemic is changes in the food supply and changes in the environment. That's where I would direct my attention. That's where opportunity resides.
Okay, thank you very much. I learned a lot in that very first answer, including if one consumes moss, you're gonna help fight obesity. Okay.
I wonder how Michael would take that translation, but it's quite clever.
Second question for you, David. How can we reduce the prevalence of being overweight and the risk of obesity?
Well, for one thing, Bill, we have to actually try. I routinely point out we've never actually tried. So while the good guys, the guys wearing the white hats, are trying to curtail rates of obesity, our culture at large runs on Dunkin', peddles multicolored marshmallows as part of a child's complete breakfast, and recommends Coke and Pepsi as national hydration solutions. So at the level of our culture, we have never actually tried. And here too, there's a lengthy discussion to be had, and the last thing I want to do is get in the way of my colleagues' good commentary. So I'll be concise and say I think we could succeed if we treated obesity like drowning. We don't wait for people to drown to do something about drowning. If unfortunately someone ever drowns, we do our best to resuscitate them. But most of our effort is directed at preventing drowning. So we have fences around pools. Every parent understands they need to keep an eye on their kids around the dangers of water. We have lifeguards at beaches. We put up signs to tell people when there are riptides and sharks and surges and stay out of the water. We do exactly the opposite for food. We tell people, come on in, the water's fine, when in fact they're being invited to consume adulterated, addictive, hyper-processed frankenfood. So I would say obesity is much like drowning, but we're drowning in hyper-palatable calories. We're drowning in labor-saving technology. And the defenses against it cannot just be clinical. They must be culture-wide. And again, with drowning, the clinical remedy is limited to those unfortunate few who actually do drown, and then it's a resuscitation effort. It's a cultural effort that prevents drowning 999 times out of 1,000, and we could and we should do much the same for obesity.
Okay, so we're all living through crazy times right now. As we record this interview, we're seeing a huge surge, a second wave of COVID-19 in many countries around the world. Do you think that, or do you know, is it possible that you can actually improve your immunity, bolster your immune system, David, by eating healthier foods, or is that just a myth? If it is true, what are some of the foods that we should be eating?
It's not at all a myth, Bill, and there are many things that could be said about the current epidemiology of COVID, but I'll avoid that, except to say I'm more optimistic than many about where we are and where we're headed, and I'll leave it at that. But on the specific issue of diet, food, nutrition, and immunity, our culture has the unfortunate problem of running everything through a prism of partisanship currently and refracting it into opposing extremes. And so, on the one hand, we certainly have people overselling superfoods and isolated nutrient solutions. And so the reaction to that action is for certain authorities to refute the relevance of nutrition to immunity. And that's just misguided. First, food is the construction material for everything our body builds. That includes white blood cells, antibodies, hormones, all the constituents of the microbiome, all of the absolutely crucial structural elements of our immune system. Second, we know full well that dietary pattern influences inflammatory responses, and that a balanced, wholesome diet optimizes those responses so that we, A, can fight pathogens like SARS-CoV-2, and B, protect our healthy native tissue. And then finally, there's the critical role of diet in the epidemiology of cardiometabolic liabilities that are the leading risk factors for adverse COVID outcomes. So there's no question about the linkage between diet and obesity, diet and hypertension, diet and dyslipidemia, diet and coronary disease, diabetes. These are, in fact, the leading predispositions other than age for adverse COVID outcomes. The effect of food on those is massive. And the best ways to optimize our immune system response, minimize our risk of adverse COVID outcomes, same answer that we would expect if ever talking about diet being good for health overall. Wholesome foods, balanced assemblies, mostly plants, lots of minimally processed or whole vegetables, fruits, grains, beans, lentils, nuts, and seeds, plain water for thirst. Michael Pollan gave us a 7-word answer: eat food, not too much, mostly plants. We obviously can embellish, but that's fundamentally correct.
Wonderful, thank you. I didn't hear Cheetos there in your answer, which is unfortunate for me.
Yeah, no, I think
Cheetos.
both Michael Pollan and I left Cheetos off the list. So
Oh,
you would need special dispensation to add Cheetos. Sorry.
Okay, well, I'll have lots and lots of extra lentils. Maybe it'll make up for the Cheetos that I eat. David, we'll be back with you again later on. I'd like to now move on and chat a little bit with Dr. Dexter Shurney, Chief Medical Officer and Senior Vice President of Clinical Affairs at Zipongo, Inc. Dexter, welcome to the show. Firstly, a lot of medicine is treating disease after someone already has it, but how important is prevention? It's certainly much easier to prevent illnesses versus treating or managing them. Do you think that clinical approaches should be altered and focus more on preventative measures?
So to answer your question, I just was saying that I love David's answer in terms of obesity and drowning, because I think the answer is very similar. Prevention is something that I think it's almost a no-brainer. It should be a no-brainer that we should focus more than we do on prevention. I think everyone realizes that it's much easier to prevent something terrible from happening than to try to fix it in the aftermath. And so the same thing is true when we're talking about chronic conditions, when we're talking about obesity. And I want to make a distinction, though, between what typically we look at as preventive services and prevention. And if we typically look at most preventive services, if you go to your doctor for a preventive checkup, they may recommend certain kinds of lab tests. They may recommend a mammogram if you're a woman, or a PSA if you're a man, to check your prostate to see if you might have cancer. They might recommend a colonoscopy, and all of that is good. But if you think about it, none of those things actually prevent the underlying condition that you're looking for. And so it prevents, greater disease or more severe disease perhaps, but it doesn't actually prevent. And so the thing that really is going to prevent this, or some of the things that we've been talking about or will talk about, and that's really comes back to our diet and other aspects of our lifestyle, how much we sleep, how much we move, how we manage our stress, our environment, and those things are key. And that's really where more prevention should be focused at. The other thing I'll just add is that those things that I just mentioned are not only good for prevention, but they're also good for treatment, and actually can be used to not only prevent these diseases, but also treat these diseases to a great extent once you have them. And it's all about therapeutic dose. If you were a smoker and you came to me and you had a bad cough, and I asked you how many cigarettes or packs you were smoking a day, and you told me 4, and I told you, well, just cut back to 3, you'd probably still have your cough. You actually have to go much further than that to see the impact. It wasn't that my advice in telling you not to smoke was bad. It was just that I didn't give you a recommendation that was actually a therapeutic dose. And so we need to think about some of these lifestyle things in the same way, but it's very powerful and should actually be the foundation of a lot of our therapies these days. So I hope that it helps to answer that question for you.
Yeah, absolutely. Thank you. So myself, like a lot of people out there, probably, certainly at the beginning of the lockdown back in March and April, I was terribly guilty, Dexter, of being bored indoors, and I kept going back to the fridge as if the fridge had been refilled, and finding myself eating terribly unhealthy things like too much cheese and whatnot. And I have to admit, I may have put on a few pounds since then. Over the last few months, I've been trying to run at least 5K a day and whatnot. It's a lot easier to put weight on than it is to lose it, for sure. With many of us still working from home and under a lot of stress, we're reaching for comfort foods, and we are still snacking much more frequently throughout the day and turning to those comfort foods. We also know that the stress in general can cause gain, of course. Can you share some simple recipes from Zipongo to help reduce unhealthy snacking throughout the workday?
Well, there's certainly a number of recipes that would fit that bill in terms of helping you with manage your weight. But let me say that probably a better approach than just giving you 1 or 2 recipes is to really think about your diet pattern. And part of that is planning. And so you really have to plan what you're going to eat so you're not just snacking when the mood hits you. And so you need to plan for yourself, you need to plan for your family, and that really will alleviate some of this, habitual snacking. And one of the things that Food Smart by Zipongo does is that we do allow people to plan for themselves and their family. And so that's one of the things that we need to do. The other thing I would recommend is that it's probably better to make sure that you get a good solid breakfast and not to skip breakfast. There's been some good research on this recently that shows that if we eat a good breakfast, we're less apt to eat as much during the rest of the day, and it also revs up our metabolism, so to speak. So that's something too. I think a lot of times people tend not to do as they should, and that is we always recommend that you get a good breakfast. So, but yeah, think about your patterns and think about how you want to plan your meals and your day, and that will really avoid some of that unnecessary snacking.
Are there certain industries? Please don't just say fast food industries. Are there certain industries or job roles that are more at risk for obesity than others?
There's an interesting statistic. It's actually sad, but more than 70% of us are either overweight or obese. And so you might conclude from that all of us are in high-risk jobs, since that's the majority of Americans. But we do know some of the risk factors beyond, what we eat. Some of the risk factors we've mentioned, such as stress, such as lack of physical activity, such as sleep. And sleep is something that we probably don't pay attention to enough, because it's not only a stressor to the body, but it does weird things with our insulin resistance. It does some weird things with our appetite, the hormones that control our appetite. And so if you really look at that, then I would have to say that people that are working the night shift, any kind of that third shift group of workers, are probably at the greatest risk if you really think about that. So, yeah, I think that there are, populations that are probably have to be a little more careful because of how they, what their work schedule is. And but, when you look at the stats, we all could probably do better regardless of what our occupations are.
Okay, thank you very much. Now then, Mesa, we haven't heard from you yet, beyond the quick hello at the top there. So I'd love to pose a couple of questions to you now. For those of us who are still new to digital therapeutics, they are evidence-based therapeutic interventions driven by high-quality software programs to prevent, manage, or treat medical disorders or diseases. Virgin Pulse, in fact, has a suite of digital therapeutic products. The newest product called VB Transform for weight management, which recently launched. Can you tell us a bit more about it?
Yeah, absolutely. So VB Transform for weight management is Virgin Pulse's digital therapeutic for overweight and obese adults. And as you noted, Bill, it is a member of a growing collection of digital therapeutics that are offered by Virgin Pulse to prevent, manage, treat, and reverse a variety of health conditions. And VB Transform for weight management, just to give a bit of a sort of framework as to how the solution works. So it's a year-long, 12 months, evidence-based behavior change program that helps overweight and obese adults achieve and maintain, I think that's the important word here, maintain clinically meaningful weight loss through moderate and sustainable lifestyle modifications, like increasing levels of physical activity and engaging in moderate dietary changes. And so, we definitely use the no dogma approach. Like Dr. Katz said earlier, we really do meet the members where they are uniquely on their journey. And we don't sort of prescribe certain types of food or activity for certain people. Our coaches are skilled at, really understanding where each individual person is and sort of tailoring the program to meet them. So I think that it's important to just talk a little bit about what the program is. So we combine connected software with integrated hardware with expert health coaching and social support. So there's sort of multi-layers of intervention within this program, and it blends evidence-based and multimodal curriculum with smart health monitoring devices like a wireless scale that we send home, an activity tracker that our members wear, with a smartphone app that's complete with behavior tracking tools like photo-enabled meal logging, for example. And then we also group individuals into a peer support group of other VP Transform members that are going through the program together, so they can offer support, seek support. They all share the same health goals, and also a professional health coach who guides and facilitates the participants and the groups using specialized coaching techniques. So we, again, just really employ this behavior change philosophy that embraces slow and steady lifestyle changes that last long after the program is complete, because we know that that's the right path, the road to achieving not just short-term benefits, of weight loss and behavior change, but long-term effectiveness and ROI for our clients as well.
Okay, blimey, I'll buy 2, please. Okay, but this is a crowded marketplace, Mesa. Is there anything else there that makes this product stand apart from the competitors?
Yeah, absolutely. So I think the first thing to point out is the difference between weight management programs and weight loss programs. So weight management is designed for, like I said earlier, long-term behavior change, and weight loss programs are not necessarily designed for that, and often employ sort of unsustainable behaviors like, meal delivery services or point counting, which can certainly help some people at a certain time, but we really do focus on the long-term effectiveness, and it's true that the market is saturated with unvalidated weight loss solutions that don't offer sort of the same benefit or the same long-term benefits as VP Transform for weight management does. And so participants in a weight loss program don't necessarily always learn how to build long-lasting lifestyle habits that promote health and weight management for the long term. And so then the payers, the health plans, our clients and the employers don't see a return on their investment with solutions like these because the results really don't last. So oftentimes they're not based in sound evidence, and definitely not decades of research like VP Transform is. And in terms of but there are other, digital therapeutics in the marketplace for weight management, right? And how is VP Transform for weight management different than other digital weight management solutions? So first and foremost, our top priority is to serve our client base by delivering effective and engaging digital health solutions. And we're really focused on driving improved health outcomes for members and reducing healthcare costs overall for the health plans and the employers. And so, we think that our clients and members get more for their investment with VP Transform than other similar products because there's a few reasons. So one, our members enjoy more one-on-one health coaching time than our competitors. So we really do have a unique coaching model, and it's unique to the industry. So, we're not sort of trying to replace our coaches with AI or robotic sort of interactions that might feel inauthentic to the user, especially for users that are really ripe for behavior change. The other thing that makes us different are our outcomes. So we're consistently, earning industry's best weight loss and engagement outcomes, and we're really proud of that. And I think another important aspect that our users and the administrators really benefit from is this connected experience, right? So a lot of digital therapeutic platforms are point solutions that lack this integration with a broader health management platform and really sort of making the problem of this disconnected healthcare experience even worse. And so our members and users really benefit from that sort of that platform that is connected, and it provides sort of greater opportunities for engagement across the various solutions. And I think that, we make it easy for our clients to invest in prevention. We offer, attractive payment models like paying for performance and billing as a medical claim. And so, the icing on the cake for our clients is that we also are more affordable than our competitors. So if you're interested in learning more, definitely get in touch with us at virginpulse.com.
Okay, perfect. Thank you. Now we are coming towards the end of this interview already, but I do want to hear from everybody one last time. But I've got one more question for you, Mesa. So in my in my usual style, I'm going to mix things up here, and I'm going to ask you to talk a little bit about demographics with me. Talk about jolly farmers and city slickers, and I want you to do it in under 30 seconds. Okay. So once considered a high income country problem, being overweight and obesity are now on the rise in low and middle income countries, particularly in urban settings. How do environmental factors impact the prevalence of obesity? In 60 seconds or less, go.
David talked about this a little bit earlier, but many factors really do influence body weight. Genes certainly play a small role, although it's not, destiny, right? Other factors like poor diet, too little physical activity, sleep, and especially our built environment. So how accessible healthy foods are and how accessible our safe places to enjoy physical activity are in your neighborhood. And it's not just a problem in rich countries, right? There's relentless marketing of unhealthy foods and sugary drinks in developing countries as well. And in most cases, the healthy option is the more expensive and harder to reach option. So while VP Transform won't solve for these sort of large global policy issues, we do offer this multifaceted approach that gives individuals the skills to make healthier choices.
Okay, I reckon that was about 55 seconds. Nice work,
Perfect.
Mesa. Nice work. Okay, so now we are approaching the end. So before we wrap up, I'd love for each of you just to leave some final thoughts. So in around about a minute or so from each of you, perhaps you can leave a final thought with the audience on health equity and managing weight, the most important thing that you want to drill home to the audience. And as part of that, I'd invite you as well to please tell our listeners more about how they can connect with you and learn about all the awesome things you're doing. David, I'd love for you to go first.
Thanks very much, Bill. And once again, pleasure to join with you, Dexter, and Mesa. So thank you for having me. I would argue there's a twofold opportunity here. First, again, to reinvoke the blue zones where lifestyle is universal medicine. Culture is the spoon that helps it go down. This shouldn't be so hard for each of us individually. We ought to have cultural support. So we all need to be good citizens. Think about how we vote in support of a safe food supply, vote in support of health promoting policies, vote in support of the world we want to live in, we want our children to live in, we want our grandchildren to live in. So that's all crucial. We really all need to be participants in a revolution for a healthy environment that makes weight management and these desirable health outcomes the norm, not the exception. But for the time that it remains something of an exception, the work that we're all doing and that's been described on this podcast is directly relevant. My own contributions are far-ranging, doing all I can to try and make a difference. So I would commend to listeners my latest book with Mark Bittman, How to Eat. We are working at my company, Diet ID, to make diet the vital sign it deserves to be. We have innovative technology that can capture full details of diet in under 60 seconds and track diet change without food logging, without reliance on recollection. The American Heart Association recently called for dietary assessment like a vital sign in every clinical encounter. We have the tool that makes that possible, so learn more at dietid.com. And then finally, Bill, I think it's important for people to realize how much global consensus there is about a sensible interpretation of the massive scientific evidence. So science, sense, and global expert consensus all come together to support routine physical activity, a diet of wholesome foods, mostly plants, the avoidance of toxins like tobacco, enough sleep, avoidance of stress, strong social interactions, a short and accessible formula that makes lifestyle the medicine we all deserve access to. And that global consensus is represented at the nonprofit I founded while I was president of the American College of Lifestyle Medicine called the True Health Initiative. People can learn more about that at truehealthinitiative.org. Once again, thank you so much for having me today.
And thank you. And I, as an individual, could probably use lots of your help. I may well be in touch. Dexter, what about yourself? Any final thoughts? And how can our listeners connect with you and learn more?
Again, thank you for the opportunity. I would say two things. One of the, if, speaking about health equity, one of the things that uh, we haven't done a really great job on, and that is making good food accessible as well as affordable. One of the things that Food Smart does is that we actually have a program called Food Secure, and it's really getting at food insecurity. And there are many aspects of it, and encourage anyone that's interested in learning more to contact me or Food Smart. But it really has features that allow individuals to find food at a discount, food that's affordable. It also allows accepts SNAP benefits online for grocery shopping. It allows people to compare baskets of food among different retailers, which is very unique. And so it really starts to get at this idea of food affordability. And so it's one of the things that we've been working on and are very proud of. I would also say that if you have one of these lifestyle conditions, and most of these chronic conditions, such as type 2 diabetes, heart disease, even certain cancers, are really driven by lifestyle. And if you happen to be one of those individuals that have one of these chronic conditions, I would also have you seek out physicians that are trained in lifestyle medicine. Both David and I, as we mentioned, are board certified in lifestyle medicine, and it's a growing field, a growing specialty. We have over 5,000 members now to the American College of Lifestyle Medicine. So it's becoming easier to find physicians that really get this and understand this. And so I would also recommend people look up that organization, and that's lifestylemedicine.org to learn more about that as well. So again, thank you for having me. This was a wonderful conversation. I wish we had, 3 times as much time, if not more, because there's certainly a lot of things we could talk about. But thank you.
Thank you. And just finally, Mesa, any final thoughts from you? And again, how can our listeners learn more?
Sure. Well, I think just in closing, it's really clear that there's this interconnection between lifestyle behaviors, chronic conditions, and preventing poor COVID outcomes. And we know that obesity is a leading risk factor for severe COVID infection and increased chances of mortality. And I think that at Virgin Pulse, we've been saying for a long time, lifestyle is medicine. And what we've learned through this pandemic is that this is true not just for health promotion. It's not true just for keeping healthy people healthy, but lifestyle is medicine for our at-risk population too. And it's remedial for both condition prevention and condition management. So while investing in prevention in yourself or in the populations that you serve, we think has always been important and something that we've prioritized as a company. I think it's even more clear now that we are in the middle of this infectious pandemic that we're all coping with, and so I think just tying those things in together is sort of a closing thought that I had after listening to David, Dexter, your insight on what's going on in the world, and sort of what we need in order to meaningfully address the overweight and obesity crisis that we have on our hands. So thank you for the opportunity to work with all 3 of you today. I really appreciate it.
Yep, this has been fantastic. Listeners, of course, this is an audio podcast. One of the reasons why that's a great idea today is, ironically, I'm a bit infectious. I've got a cold today, so you definitely wouldn't want to see me in person. However, I would love to get David and Dexter and Mesa back on, and we could do some sort of a webinar. Guys, I'm also the co-founder of an event series for HR folk called Innovate Work, which we've been doing since 2017. We do that all around the world. So I'd definitely love to get you all on as speakers. We can talk about that offline, but that just leads me to say to each of you, thank you so much for joining me on this special episode of the HRchat Show.
Thank you for listening to the HRchat podcast, brought to you by the HR Gazette.